It says we're doing it.
Good morning to you all. My topic for today's presentation is postural orthostatic tachycardia syndrome. So the reason I chose this topic for today is because we saw an interesting patient in the clinic. I wanted to share it with you all today. So we had a young lady in her 30s who presented with tremors since 5 years. And she was a person who was a really active person and had a competitive cheerleading career. But as her symptoms progressed, she noticed that she started dropping things. She couldn't hold on to things anymore like she used to. She had difficulty in typing. She felt excessively fatigued and she had sleeplessness. And because of that, she had to take excess shots of caffeine because she was tired throughout the day. And she also noticed memory problems like fogging and short-term memory issues, which was actually affecting the quality of her life and work. She also had to put a pacemaker because of dysautonomia. And when we did the TM flow test, it came out that she had a small nerve fiber neuropathy, which is the neuropathic form of POTS. So coming to postural orthostatic tachycardia syndrome per se. So this is a disorder of the autonomic nervous system. In other words, it is called as dysautonomia. It has been known by different names like the mitral valve prolapse syndrome, neurocirculatory asthenia, orthostatic tachycardia, and orthostatic intolerance. So how do we define POTS as such? It is defined as the orthostatic intolerance for at least a period of 6 months with an increase of heart rate for at least 30 beats per minute within a 5 to 30 minutes of assuming an upright posture. But the criteria is, it is diagnosed only when orthostatic hypotension is ruled out. And there are no other conditions which causes a decrease in blood volume like dehydration or blood loss. And in the US, we see that around 1 to 3 million people are suffering from this condition of POTS. Coming to the pathophysiology. So let's see what happens when a person stands upright. So when a person assumes an upright posture, there is an instantaneous descent of around 500 ml of blood from the thorax to the lower body, that is the buttocks, the lower extremities, and the lower abdomen. And there is around a 10 to 25% shift of plasma volume into the interstitial tissue from the vasculature. So because of this, there is a 10 to 20 beats per minute increase in heart rate, a negligible change in the systolic blood pressure, and around a 5 millimeter increase in diastolic blood pressure. But it is seen that in normal people, they develop a transient tachycardia within the first minute of standing. So it is important that we observe the patient to about 5 to 10 minutes and see that there is an actual increase of heart rate to more than 30 beats per minute to actually diagnose this condition. Coming to the types and causes, there are mainly 4 types, that is the neuropathic, hyperadrenergic, hypovolemic, and the secondary type of POTS. Firstly, the neuropathic type of POTS. So this is associated with a damage to the small fiber nerves, and it is also called as small fiber neuropathy. So what happens is when there is denervation of these fibers, which supply the small vessels, there is a reduced vasoconstriction. And because of that, there is pooling of blood in the lower extremities. So that gives a bluish discoloration to the extremities when they are affected. The second is hyperadrenergic POTS. This is associated with high levels of the stress hormone norepinephrine. And around 30 to 60% of POTS is because of the hyperadrenergic type of POTS. Thirdly, coming to hypovolemic type of POTS, this is always associated with hypovolemia. The last type is secondary type, which is associated with autonomic conditions like Lyme's disease, lupus, Sjogren's syndrome, and autonomic neuropathy such as diabetes. Coming to the symptoms. So there are a variety of symptoms like fatigue, lightheadedness, just like how our patient had brain fog, memory problems, palpitations, vomiting, headaches, sweating, shakiness, and intolerance to exercise. And we also see that there is a purple discoloration of hands and feet if the limbs are lower than the level of the heart. And there is a dependent acrocyanosis, that is a bluish discoloration, in 40 to 50% of the patients with POTS. So how does the symptoms arise? So these occur by a combination of mainly three factors. That is when there is a less amount of blood in the circulation, when there is excess pooling of blood below the level of heart when they stand upright, and when there is an elevation of some hormones like epinephrine and norepinephrine, especially when norepinephrine is more than 600 picogram per milliliter. We also see that the symptoms worsen in certain conditions like warm environments, when people stand a lot. So the typical history would be the patient had stood for a long time in the waiting queue and they have a precipitation of symptoms. And also when they don't take enough fluid and salt. Now coming to the population at risk. There has been a lot of research going on in this topic, and we see that a majority of the patients are women who are aged between 13 to 50 years of old age. And we see that POTS usually develop after viral illnesses, pregnancy, trauma, and serious infections. They also develop who have a recent history of mononucleosis, autoimmune conditions like Sjogren's syndrome, and celiac disease. Now coming to the diagnosis. One of the main tests that we do for POTS is the tilt table test. So what we do here is we secure the patient on a table when they lay flat, and then we raise the table to almost an upright position. So in this position, we test for their heart rate, BP, blood oxygen, and also their exhaled carbon dioxide. And only if they meet the following three criteria that we suspect POTS. Firstly, they have to have an abnormal heart rate response when their position is being changed to upright of more than 30 beats per minute. The second one is that symptoms should worsen when they are upright. And the third one is the patient does not develop orthostatic hypertension in the first 3 minutes of testing. We have to observe them for at least more than 5 to 10 minutes. The next criteria is the plasma norepinephrine levels should be measured in the supine and the standing position. The supine norepinephrine is often normal high, while in the upright position, it is elevated more than 600 picogram per ml. The other tests which can be done are the Valsalva manure to test the response of autonomic nerves that control the heart, the quantitative pseudomotor axon reflex test to measure the response of the autonomic nerves, and MRI and other imaging tests to rule out other tumors. Coming to the treatment. So the first and important thing that we have to take care before we start treatment is we have to identify if there are any other reversible causes and any other medications which can contribute to this, like vasodilators or diuretics. We also have to treat any reentrant supraventricular arrhythmia. But what we have to keep in mind is radiofrequency sinus node modification for the sinus tachycardia is not recommended because it makes the patient's symptoms worse. And sometimes the patient might also have to have a pacemaker. Coming to the treatment per se. First drug is fludrocortisone, which helps the kidneys to retain sodium and helps retain the blood volume in the body. The second is beta blockers, which helps in reducing heart rate or blocks the effect of adrenal hormones. Third is midodrine, which improves the constriction of blood vessels. Fourth is modafinil, which can be used as a stimulant in patients who has memory problems, who has brain fog, etc. Oral vasopressin, which is an expanding agent, which can be used for short term. And the last one is the clonidine, which is an alpha-2 agonist to decrease the sympathetic nervous system tone. We can also use compression garments, which helps to reduce excessive pooling in the blood and prevents the symptoms. Coming to diet, there are many things that the patient has to take care of. First being hydration. They have to make sure that they are hydrated and by having plenty of fluids. And the goal is at least to have 2 to 2.5 liters of fluids a day. And they also have to take salt in addition. So they have to increase the sodium in their diet to 3,000 to 10,000 milligram per day. They can do this by using salt tablets or a diet with a salt shaker. They are recommended to have a diet with high fiber and complex carbohydrates so that the symptoms don't precipitate. By this way, we can help keep water in the bloodstream so that more blood reaches the heart and the brain. Coming to exercise. So it is important that patients with POTS don't exercise more than their capability, because if they do more than their capacity, their symptoms can get worsened. So physical therapy has to be started slowly and advanced based on their tolerance. Now, as the blood circulation improves with all the modifications in diet, medications, then we can increase the exercise intensity. And our goal is to retrain the autonomic nervous system to allow for more exercise. Aquatic therapy is another modality which can help some patients because of the water pressure that is being created around the body and compresses it. Now, some patients may benefit from certain postures like sitting, sleeping, and when standing, they stand with legs crossed and sitting in a low chair to compensate for their symptoms. So it is very important to do a tilt table test and measure the body's response in both the supine and the upright position to see the response without these adaptive habits. Now, coming to the differential diagnosis. Pheochromocytoma is a condition which has many hyperadrenergic symptoms like high blood pressure, palpitations, tremors, sweating, pallor, shortness of breath, which can be confused with the hyperadrenergic symptoms of POTS. But in patients with pheochromocytoma, they have symptoms while lying as well. And we can diagnose it by measuring the plasma or urinary metanephrin. Another condition is neurally mediated syncope or the vasovagal syncope, which is precipitated by stress and prolonged standing. These are the references that I used. Thank you for your time and patience.